Good morning, John. I'm Sarah. I'm the physiotherapist who'll be seeing you today. Please have a seat. Before we begin, I'd like to explain what we'll be doing in today's session and get your consent to proceed. Is that all right?
Yeah, sure, that's fine.
Great. So today I'll be asking you quite a few questions about your back pain, things like when it started, what makes it better or worse, that sort of thing. Then, if you're comfortable with it, I'd like to do a physical examination, which would involve looking at how you move, testing your strength and reflexes, and possibly some gentle movements of your back and leg. The whole process should take about 45 minutes to an hour. Are you happy for me to proceed with this assessment?
Yes, absolutely. I just want to know what's going on with my back, you know? It's been driving me mad for weeks now.
I completely understand, and hopefully we can get some answers for you today. Everything we discuss is confidential, and you can stop at any time if you're uncomfortable. Now, shall we start with you telling me about this back pain? So, John, can you tell me when this all started?
Well, it was about, let me think, 6 weeks ago now. I was helping my mate Steve move house, lifting boxes, furniture, that kind of thing. I felt fine that day, maybe a bit tired, but the next morning I woke up and, Christ, my back was killing me.
Okay, so it came on the day after the moving. Was it sudden when you woke up, or did it build up gradually?
It was there when I woke up, but not too bad initially. I thought it would just go away, But over the next few days, it got worse and worse.
Right. And can you describe what the pain feels like now?
Now, it's going down my right leg too. Sometimes it's sharp, sometimes it's more like a burning feeling down my leg.
That's helpful. On a scale of 0 to 10, where 0 is no pain and 10 is the worst pain you can imagine, how would you rate your pain right now?
Right now, probably about a 6. It's always there,
And what's it been like at its worst?
Oh God, there have been times when it's been an 8 or 9. Usually when I'm trying to get out of bed in the morning or if I've been sitting too long.
And at its best?
At its best. Maybe a 4. It never completely goes away, though.
Okay, you mentioned it goes down your right leg. Can you show me exactly where?
It starts here in my back, goes into my right buttock, and then down the back of my thigh. Sometimes it goes all the way down to my calf, but not always.
Does it ever go into your foot or cause any numbness or tingling?
Sometimes I get a bit of tingling in my foot, mainly at night. And sometimes my leg feels a bit, weak, like when I'm going upstairs.
That's important information. Now, what makes the pain worse?
Sitting is terrible. I work at a desk all day and by lunchtime I'm in agony. Getting up from sitting is awful too. It takes me a few seconds to straighten up, and bending forward to tie my shoes or pick something up, that's a nightmare.
What about coughing or sneezing?
Oh yeah, that makes it much worse. Sharp shooting pain down my leg.
And what helps ease the pain?
Walking seems to help a bit actually. Not at first, but after a few minutes it settles down. Lying down helps too, but only in certain positions. I've got this recliner chair that's been a godsend.
Which positions are most comfortable for lying?
On my side with a pillow between my knees, or sometimes on my back with my knees bent up.
Good. Now, can you tell me about your pain over a 24-hour period? What's it like when you first wake up?
Mornings they're really tough. The pain is usually at its worst when I first try to get out of bed. It takes me about 10-15 minutes of moving around before I can stand up properly.
And during the day?
It builds up, especially if I'm sitting. By mid-afternoon, I'm really struggling. I've started taking regular breaks to walk around the office, which helps a bit.
What about evenings?
Variable, really. Sometimes it's not too bad if I've been moving around, but if I sit down to watch TV, it flares up again.
And how's your sleep affected?
That's probably the worst part. I wake up several times during the night, usually when I try to turn over. The pain shoots down my leg and wakes me up. I'm getting maybe 4-5 hours of broken sleep.
I'm sorry to hear that. Now, I need to ask you some important questions about other symptoms. Have you noticed any changes in your bladder or bowel function?
No, nothing like that.
Any numbness or tingling around your genital area or bottom?
No, definitely not.
Any weakness in both legs or difficulty with balance?
Just the right leg sometimes feels weak, like I mentioned, but not both legs, no.
Any fever or feeling generally unwell?
No, I feel fine otherwise.
Any unexplained weight loss recently?
No, if anything, I've put on weight because I'm not exercising.
Have you had any previous episodes of back pain?
Yeah, I've had the odd twinge over the years. Nothing like this, though. Maybe once or twice I've had a stiff back for a day or two, but this is completely different.
What treatment have you tried so far?
Well, I went to see my GP after about 2 weeks. He gave me some stronger painkillers, diclofenac, I think, and told me to rest. I tried that for a week, but it didn't seem to help much. Then I tried some ibuprofen and paracetamol, which takes the edge off but doesn't fix it.
Are you taking any other medications?
Just blood pressure tablets. Ramipril, 5 milligrams once a day.
Any allergies or previous surgeries?
No allergies. Had my appendix out about 10 years ago, but that's it.
What's your work like day to day?
I'm an office manager, so lots of computer work. Long hours too, usually 8 or 9 hours a day. My desk setup probably isn't great either.
And what are you hoping to achieve from physiotherapy?
I just want to get back to normal, you know. I want to be able to work without being in constant pain, sleep through the night, maybe get back to playing tennis at weekends. I'm worried this is going to be permanent.
Thank you for all that information, John. That gives me a really good picture of what's been happening. Now, if you're comfortable, I'd like to do a physical examination. This will help me understand what's going on with your back and leg. Is that okay?
Yes, that's fine. What do you need me to do?
I see you're sitting with quite a forward posture. Do you tend to sit like this most of the day at work?
Yeah, I don't even notice it, but I guess I do hunch forward a lot.
Okay, I'll guide you through everything. First, I'd like you to stand up and I'll observe how you move. Then we'll do some simple movements and tests. If anything is painful or uncomfortable, just let me know and we'll stop. Okay?
All right, sounds good.
Great. Can you stand up for me?
Oof, that's always the worst bit.
I can see that's uncomfortable. Take your time. Now, I'm just going to observe your posture and how you're standing. Can you bend forward as if reaching for your toes?
I can do it, but it pulls a bit in my back.
And does this movement bring on any symptoms down your leg?
Not really, just discomfort in my lower back.
Okay. Now, try leaning backward.
That makes it worse. Feels like pressure in my lower back.
Let's check your leg strength. Try to lift your knee up against my resistance. Good. Now push your foot down like you're pressing a gas pedal.
That feels a bit weaker on my right side.
Now I'll lightly brush along your leg. Tell me if any areas feel different. All right, John, let's do a test to check how your nerves are moving. Lie on your back for me. Let me know when you feel any symptoms.
That feels tight in my hamstring, but I also feel a slight pull in my lower back.
Okay, John, that's great. Thank you. I'd like to go through what I found and discuss what I think might be happening.
Please, yes. I just want to know what's wrong with me.
Based on everything you've told me and what I've found in the examination, I believe you're dealing with what we call lumbar radiculopathy. That's a fancy term for irritation of one of the nerves in your lower back.
A nerve? Is that serious?
It's not uncommon, and while it's certainly uncomfortable, it's something we can work with. What's likely happened is that one of the discs in your lower back, probably between your L5 and S1 vertebrae, has been irritated, possibly bulging slightly, and it's putting pressure on the nerve that goes down into your right leg.
So, when I was lifting those boxes,
The heavy lifting may have been the final straw, but often these things build up over time. Your job involves a lot of sitting, which puts pressure on those discs, and the lifting episode might have just tipped it over the edge.
will it get better? I mean, I'm not going to need surgery or anything, am I?
The good news is that most people with this condition do get better with conservative treatment that's physiotherapy, exercise, and sometimes medication. Surgery is rarely needed unless there are serious complications, which you don't have. Now, I'd like to work with you to set some goals for your treatment. What would you say is your main priority right now?
Honestly, I just want to be able to sleep through the night. The lack of sleep is killing me.
That's a great starting point. So our first goal could be to improve sleep quality by reducing nighttime pain episodes from waking 5 times per night to no more than once per night within 2 weeks. Does that sound achievable?
Yes, that would make such a difference.
What about work? You mentioned struggling at your desk.
I need to be able to sit for at least 2 hours without having to get up. Right now, I can barely manage 30 minutes.
Perfect. So goal number 2, to increase sitting tolerance from 30 minutes to 2 hours with manageable pain levels, NRS 4 or below, within 4 weeks. How does that sound?
That sounds brilliant. What about longer term?
What would you like to be doing in 3 months' time?
I'd love to get back to playing tennis. I play twice a week usually, but I haven't touched a racket in 6 weeks.
Excellent. Goal 3, to return to recreational tennis, playing twice per week without significant pain increase within 12 weeks. Now, for treatment, I'm going to start you with some gentle exercises and positions that should help reduce the pressure on that nerve and promote stability in your low back. I'll also give you some strategies for managing your sitting at work and sleeping positions. We'll progress, gradually improving your strength and function as we go, but no heavy lifting or aggressive stretching yet. To start, we need to reduce strain on your lower back and improve overall stability. One of the key factors is postural corrections, making small adjustments to how you sit throughout the day to minimize stress on your spine. Alongside this, we'll introduce gentle mobility drills to help ease stiffness while maintaining controlled movement, ensuring you stay mobile without irritating your symptoms. We'll also incorporate isometric core activation, which allows you to engage deep stabilizing muscles without causing further discomfort. Finally, we'll focus on activity modifications, such as avoiding prolonged sitting and adapting your work habits to prevent aggravation and promote recovery.
So I need to change how I sit all day?
Yes, small adjustments will make a big difference. Things like lumbar support, standing breaks, and movement-based sitting strategies. Once your back starts feeling more stable, we'll shift towards building strength and control. We'll focus on core strengthening, particularly engaging your transverse abdominis and glutes, which play a key role in spinal support. To safely bring back lifting into your routine, we'll introduce progressive loading strategies, ensuring you use proper mechanics and reduce strain on your lower back. Alongside this, we'll incorporate dynamic control drills to improve how your spine handles movement, helping you feel more confident with daily activities and preventing future flare-ups.
Does that mean I can start lifting things again?
Yes, but in a controlled way, we'll focus on hip-driven mechanics to avoid excessive spinal strain. Once your back feels stronger, we'll shift our focus to getting you back to full activity. We'll start with a gradual reintroduction to sports and heavier tasks, ensuring you move safely without placing unnecessary stress on your spine. Alongside this, we'll incorporate endurance training, helping your core sustain prolonged sitting and dynamic movements without fatigue. Finally, we'll integrate preventative strategies, maintaining mobility, strength, and control long-term to reduce the risk of future flare-ups and keep you feeling confident in your daily activities.
Okay, that makes sense. How long will this take?
Usually around 8-12 weeks, but we'll reassess every few sessions to track your progress.
That sounds good, but what about the exercises? Will they hurt?
Some mild discomfort is normal, but sharp pain or increased leg symptoms means we stop immediately. The key is little and often. I'd rather you do 5 minutes 3 times a day than 15 minutes once a day.
Okay, I can manage that.
I'd like to see you twice a week for the first 2 weeks, then we'll review progress. Does that work with your schedule?
Yes, I can make that work. When do you think I'll start feeling better?
Everyone's different, but typically we see some improvement in sleep and sitting within the first 2 weeks if we're on the right track. The leg symptoms often take a bit longer to settle.
I just want to get back to normal.
And you will. Are you happy to proceed with this plan?
Absolutely. I'm just glad someone finally knows what's wrong and has a plan to fix it.
Let's start with some basic exercises today and we'll build from here.